Please rise for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Good evening. Welcome to the Planning Board meeting of January 8th, 2026. First on the agenda is Carmel Residential, 119 Seminary Hill Road. Mike, any comments?
I do not. Same as last time. It's on for a seeker resolution, I believe. Yes.
Correct. And Rich?
Same as Mike.
And Pat?
So, Mr. Chairman, as you saw at the last meeting, the applicant slightly modified the plan. We had previously adopted the seeker negative declaration for this. Because the plan has changed, the negative declaration has to reflect that change. That's the document that you have before you this evening.
I believe we're all familiar with the modification. Really had no impact on sewer, water, traffic. That being said, any comments from the board? If not, we need a motion to adopt a secret neg deck.
Mr. Chairman, I'll offer the resolution of the Planning Board of the Town of Carmel, number 26-1, January 8th, 2026. Carmel Residential, 119 Seminary Hill Road, Carmel, seeker, determination of significance, negative declaration.
Second.
All in favor?
Aye.
Thank you.
So next steps for us, we've addressed all the outstanding comments that we have with you guys. We had some minor comments go back to DOH, Department of Health this morning, DEP this morning, ministerial cleanup, labeling, things like that, nothing that affected the plans that are before you. Is it possible to have an approval resolution drafted for this?
So we would need to see what those departments have said. Zach,
Sure.
so pass that information along to us first. I think we would need to see, just to confirm, I'm sure you're telling the truth, but we need to confirm that.
Okay.
You can get them to Rose, and Rose can communicate and share them with Pat, and we'll move on.
Yeah, I'll forward you guys the emails that were sent out. So we're at the end with them. I don't want to trade paper back and forth with them. And typically, when you get to the end of the DEP and DOH, you can send them PDFs of, hey, here's your final changes. So,
Sounds reasonable. Okay.
great.
Next on the agenda tonight is People USA, 1071 Stoneleigh Avenue. It's for an amended site plan. Just for everybody in the audience, we had many public hearings on this. We've extended the public hearing a couple times. We also left open the written comments. So this tonight is just to listen to People USA responded to a lot of the board's comments, which actually came from you.
Good evening, Chairman Rebecca Volk, Law Office of Rebecca Volk, on behalf of People USA. Steve Nicchio, CEO of People USA, is here with me, as well as Rich Tompkins from Mori Architects. We also have other representatives from People USA here in the audience. As the chair stated, we have submitted responses to the gathered questions that the board asked us to respond to, and we submitted that document. The one item that does remain outstanding is we are having a traffic engineer study our location in Dutchess County to do a analysis of what the anticipated traffic would be out of this facility, which the town has agreed is classified as a professional office. And we expect that information to come in by Tuesday of next week. But given the holidays, it was a little difficult to get a traffic engineer on target.
Okay, understand. Do you want to respond to the questions now?
Sure.
I'd like everyone in the audience and on TV to hear the responses.
Okay.
You meant Putnam when you said the
Well, they're
traffic.
studying, and then they're going to do an extraction based upon, because we serve a larger population there, and then they're going to study the location here and determine what, because we are a use that you can't just simply compare us to anything else. So they were actually there today counting cars in Dutchess based upon the capacity there, and it is a smaller population here in Putnam.
So there's nothing in that guidebook, the engineering guidebook for this type of use?
There is, but they're comparing it with their other use.
Okay.
Yeah.
Okay. Hi, Steve Nicchio, CEO of People USA. They wanted to document the operational characteristics of the proposed facility. And I'm just going to read it, I guess, is the best way to go?
Sure.
Yeah? Okay.
I've read the document
Yeah,
you responded to,
this is
but
for
I
the-
want the
Sure.
residents and the people on TV watching.
Okay. Per the Part 600 regulations, a supportive crisis stabilization center means that a center that provides support and assistance to individuals with mental health or substance use crisis symptoms and who are experiencing challenges in daily life that create risk for an escalation of behavioral health symptoms that cannot reasonably be managed in the recipient's home and/or community environment without on-site supports, and do not pose likelihood of serious harm. The center provides voluntary services for those who require support, with an emphasis on peer and recovery services. Supportive crisis stabilization centers provide or contract to provide behavioral health, observation, stabilization services 24 hours a day, 7 days a week. Reasons for the siting of the facility at this location.
Before you go on, I have a question about
Yes.
what you did. I want to focus on the phrasing and the words which you have in bold, and do not pose likelihood of serious harm. Can you explain how that is determined, what the process is, who does it, where
Sure.
it takes place?
Sure. We have clinical staff that work at the crisis center who have expertise in assessment of people with behavioral health issues. And when they come in, there's a series of questions that they have to answer, plus they do a visual observation of the individual that comes in and can make a determination based on their clinical experience whether the person might pose any harm to themselves or others.
So what happens if you determine somebody poses the likelihood of serious harm?
Yeah, if there was any fear that the person posed any kind of serious harm to self or others, then we'd follow the protocol of calling an ambulance to bring them to the hospital for an evaluation, for more of a medical evaluation than psychiatric evaluation.
You'd call the ambulance for somebody who is, I'm just positing, potentially violent?
Well, the police are always arrive with the ambulance, so the police would come as well.
So what if a person just shows up on their own, not sent?
I would just ask, it's very difficult to hear
Yeah.
both the board with the community.
This is not a public hearing tonight, so no one from the audience, and I'll ask Bob to speak louder, okay?
Okay. Is this better? Can you hear? Okay. So if somebody inducts themselves into the center, and they're agitated, you decide that they're potentially violent, you will call an ambulance, and in each case, police come with the ambulance?
Yeah, but the explanation that I've been giving is that when people voluntarily come to the center, they're looking for help, even if they're agitated. The staff are highly trained in de-escalation. So the Duchess Stabilization Center has had very few people that have come in and agitation has escalated. It's usually they come in and they are de-escalated when they come to the center. It's a voluntary facility. It's not a facility that people are being mandated to go to. So that's something I think people need to understand, is that they're not just going to walk in angry just to be angry and attack people. They're coming in for help when they come to the stabilization center.
Can you give me just,
I'm still not comfortable with what I'm hearing about the odd case or the rare case when somebody is a risk of serious harm, and you cannot talk them off the ledge and exactly what happens. It just seems, if somebody was in my house, to be frank, and they were an obvious risk of being violent, I would call the police, not an ambulance.
Well, as I was saying, it would be police and ambulance that would come. I just want to be clear on that.
Is there a protocol that requires the police to be called
We have protocol, yeah.
to do that?
If there's escalation of harm to the safety of the community or the people in the stabilization center, yes.
And And the words say the likelihood of serious harm. What does serious harm actually mean?
Harm to self or others is how it's stipulated in mental hygiene law.
Can you give me a sense, I know you said highly trained personnel. What
Could
type-
I ask you to
Oh,
get
sorry.
your
Yeah,
microphone?
sorry.
Thank you.
Highly trained personnel you mentioned. Can you
Yeah.
give me a flavor of what that means? Do they get certified? Do they have to go back for retraining after a
They're
certain time?
licensed clinicians,
Okay.
so
But
they
what
have a
kind-
license
Right.
to provide services. The staff, the peers are also certified. Everyone in the facility is certified in some way, whether it's nursing or whatever, but they are licensed and/or certified to serve, which means they have to go through extensive training to deal with de-escalation. We are also the organization that trains police on the 40-hour crisis intervention team training so that they can understand and escalate people better in the communities. So we have been really focused on de-escalation, but we're also focused on improving people's quality of life at the same time.
How many staff members are typically on call or
Well,
there?
there would be a mental health counselor, there'd be a social worker and/or a social worker, so it could be a counselor and/or social worker. Peer specialists are there, nursing staff is there, certified crisis counselor, or a certified and credentialed substance use counselor is there, and sometimes a youth peer advocate, could be, on or off, and the RN, the registered nurse.
And that's at all hours of the
Yeah.
opening?
Yeah.
So I would just note, we actually jumped ahead to answering another question that was responded to, which identifies the training and licenses held by the staff that will be at the facility.
Right. So back to the reason why the siting of the facility at this location. This location was chosen as per feedback from Putnam County that Carmel both has the need for services and that it is centrally located to Putnam County. The next question was what other locations were considered before selecting the proposed site. Based upon community need, building size, zoning laws, market availability, multiple locations have been assessed across the county, including Putnam Hospital, which was not selected because it was not appropriate. Brewster Southeast, we were very optimistic about this location and successfully worked with the landlord on a potential lease. It should be noted that the individuals we served have recognized disabilities under the state and federal laws. However, the town of Southeast prejudged the application based upon the individuals we served. The town took actions that, in our opinion, violated federal discrimination laws to prohibit People USA as a tenant in their community. Other locations were considered but were not viable due to size, location, or availability.
So let me ask you, take a step back. You brought up Putnam Hospital in your response.
Yes,
Why is Putnam Hospital not?
good question. These were designed to be outside of hospitals. Hospitals are where most of the trauma and most of the damage that happens as far as marginalizing people that are seeking help happen. So the idea of stabilization centers are all off grounds or away from hospitals so that they are more of a community comfortable place to go, like a like an urgent care. And these are people that, again, are not being mandated. And the accessibility in the hospital was wrong anyway. You had to walk into a doorway that originally was not open, where they were looking, allowing us to possibly rent. The hospital doesn't own the building that we were looking at, that is the hospital. So that's another part of it. And they had intentions of renting it to other people anyway. So they were entertaining us, but at the same time, we saw that it wasn't a fit. It doesn't fit the stabilization center model in New York State, so we nixed on the hospital.
Yeah, because there's an article that was published back when you were looking at Brewster, and it quotes the hospital president, Mark Herco, I believe his name is, talking about how there was conversation, but then conversation stopped. But he says here that he'd be happy to continue conversation with county leaders to find the right location. I mean, I get it. I understand an emergency room might not be the best venue for what you're doing.
Right.
But I mean, is there no other space at the complex where the hospital is that
No.
would work?
No, again, it doesn't fit the model of a stabilization center, which should be off the grounds of a hospital. There are no
That's a
stabilization
different
centers.
question than what Ray asked, is there no other space? And you went back to the model. So I guess the question is there space rather
No,
than?
in the end, there wasn't space. It wasn't suitable for the stabilization center at all.
Okay, so there was space, but it wasn't space that you considered
Right.
suitable.
So we had gone there, we met the president, or the CEO of the hospital. They were very kind. They were showing us the place, then told us they don't own it. So that was one strike against us. And then it also didn't fit the model, and the accessibility was not good for that area.
And then you also say in your answer that, you know, the county gave you feedback on, you know, the needs and where.
Could I ask again if you got a little closer to your microphone?
You
Thank
also
you.
said that the county gave you feedback about the needs, but your original focus was Brewster as opposed to Carmel.
I don't think it's fair to say the original focus. I believe
Yeah.
the client has looked all over the county
Yeah.
for space.
Yeah.
Everywhere. We've heard comments about, well, there's plenty of vacant land, you need to find an individual willing to sell. You need to find an office space willing to rent. Those have been very few and far between, and it took a long time to find the two facilities that we felt that we had at least some lead on.
So getting back to the Southeast Brewster, so no possibility of reopening that negotiation? I mean, if it was the right location? And I know also you said that Carmel, quote-unquote, was central to Putnam County. It really isn't. It's in the upper right-hand corner of Putnam County. It's a big county. So is there anything else anywhere else? And can we not look
We
at
did
Brewster
an
again?
extensive search. We
Yeah.
really did. I mean, this was 3 years in the making here, and we went everywhere. And we would look at everything.
Yeah. So what happened again with Brewster, Southeast?
Was that the moratorium?
Yeah. They adopted some land use moratorium, and despite my vigor in suing on that, there was not appetite from Putnam County at that time
To do,
to sue,
To
because
sue
I
them.
think we would have been more than successful.
I don't follow you. There was not appetite from Putnam County to sue?
Because they've been providing this through ARPA funds. We are funded through our Putnam County for this project.
Oh, okay.
So where's the funding stand today? You mentioned funding. Is the funding still, was there a time?
It's
frame
still
on the fund?
available, yep, it's still available, it's still there. We have a contract with the county to move ahead.
I believe that was touched upon by the county executive when he was here in October.
Yeah.
Okay.
Okay. Is the location of this facility as proposed a decision of People USA alone, or are other agencies involved in the decision to site a facility in a particular location? The decision is People USA's to site the service at the proposed location after an exhaustive review of the other potential locations, as discussed above. We made this decision with support from Putnam County Department of Mental Health and the County Executive's Office. Are these standards for this siting? Are there standards for the siting of these facilities? There are regulations as to the programmatic operation of stabilization centers, but no standards for the physical site. We're citing new Part 600 added to Title 14 of the NYCRR. The standards of the physical site will be different in each county and community due to population and needs. What are proposed security measures? What are the qualifications of security personnel on site? We will contract with a security company that will work overnight shifts. They will likely do the 11 to 7 shift. Staff will train security personnel on de-escalation techniques and use our internal crisis intervention trainers who are experienced on delivering crisis intervention trainings to law enforcement. Additionally, yeah.
Excuse me. Why would you have the security company only at overnight hours and not all 24 hours?
We really haven't had the need. As we had stated in Dutchess County, they were citing their security in our facility for a while for 24/7. They're no longer there, but they are overnight.
So what is it about overnight versus daytime? What differentiates that for you in terms of need?
But, to be honest, we don't really need it. We're doing it so that the community feels that it's a safer place in their community. We really don't feel the need for it.
So, go ahead.
No, go ahead.
I'm focusing on the hours. It seems that there's a concern that something is more likely to happen, or there's a risk of something happening at night that will not necessarily happen, or there's not the same level of risk during the day, and I'd like to understand why.
I think the client just responded to that in the sense that they don't feel it's necessary. However, they've been providing it in the evening hours as a matter of security. I think if we flipped it around, if we had offered 24 hours, then the question would be, well, why do you always need security there? We have indicated that the experience in Dutchess County has stated that it is not needed on a regular basis. However, they have continued to provide it overnight.
The Dutchess County facility is not as close to residents as this one is, though, correct?
I would say if you walked, it would be the distance from up the hill. I live in that community myself, so.
No, the houses around are pretty close to where that's going to be, so that's an
But
issue.
they're also flat street blocks to where it
Yeah.
is here, not here in Poughkeepsie.
Okay.
And so to go back to the question about the security, so you tell us that there's no need, but the spreadsheet that we got from the police chief, which was obtained from the Poughkeepsie Police Department, indicated that during that period, there were 52 calls for the police department to respond to the facility. That's not including ambulance, that's just police.
Right.
Okay.
And this was misrepresented because these were.
If I could finish my question.
Sure.
So what I'm saying is, 52 calls for the police, to me, suggests that perhaps there is a need for security. I'm just throwing it out there, I think that that's certainly an indication, not proof positive, but an indication that perhaps security would be helpful.
Okay, please
Okay.
move on.
What hours were you referencing, the 52?
What hours?
Yeah, you said during that period there were 52. You're
During the
saying
time period. They give us an Excel spreadsheet that has.
Of approximately a year, I
I believe it
believe?
was a yearly, I believe it was an annual look.
Hi, so I'm Cheryl Spencer Frost. I'm both the identified director for the stabilization center, but I also do data from People USA, and we did address the spreadsheet when it did come up, initially, I think back in October. So the 52 calls that you're talking about for the police assistance were over a period of about 20 months. From the beginning of 2024 until, I think, the end of August of 2025. So including all of the EMS calls and the calls for police assistance for Dutchess County, that came to about 8 calls on average per month, and taking the ratio for the population for Dutchess County, and then the population for Putnam County, taking those 8 calls a month, it would average about 3 calls a month if we use Dutchess as the model.
But you're not restricting clients, as you refer to them, you're not restricting them to Putnam County.
No, but we also don't restrict in Dutchess County either. Any transportation that is provided to come to the stabilization center has to be from in-county. We don't provide transportation for somebody that is out of county to come to our stabilization center because the catchment for us is Putnam County. If somebody walks into the facility that is outside of Putnam County, we will absolutely see them and support them in that moment. But we do not bring people from out of the area to the center.
But if Westchester or the Bronx calls up and says, we have overflow, we need to bring somebody up to you, will you take them? We'll ship them to you. Will you take them?
So there are and will be resources in, say, Westchester. We are opening a stabilization center in Westchester. There's 2 more opening in Westchester as well. So
But you're not answering my question.
I believe she's getting to the answer. Just wait a moment, sir.
So if somebody calls us from out of our catchment area and needs the resource and says, I don't know what to do, we will direct them to their local resources.
And what if they say they're full, I need to bring them to you? Which is
Well-
what we heard goes on at the Dutchess County facility, I thought.
What do you?
And I'm
there-
sorry, where did you get that information?
I think from previous discussions here.
There is no overflow from any of these facilities, and any of the facilities that you're talking about, such as a facility in Westchester, another place, they have their own policies and procedures for any overflow or any outside of their capacity that would not include directing to our facility, because that would not be an appropriate use of our facility.
I'd also like to add that a hospital or other crisis facility is not going to utilize a supported stabilization center if they're overflow. That's never happened. I mean, that would be going backwards. So the hospitals are the ones that are handling any overflow in crises.
Okay, please continue.
Okay. Do these facilities have documented impact on community character? This question is difficult to answer, as community character does not have one standard meaning. Different individuals can have different interpretations as to what defines their community character. We also respectfully note our objection to the implication in this question that providing needed services to the family, friends, and neighbors in any community would have a negative impact. To our knowledge, no studies have been conducted to measure any negative impact on communities. We can provide written testimony from the Office of Mental Health as to why they support the Crisis Stabilization Center model in New York State. What impact do these facilities have on surrounding businesses and the local economy? Having unique crisis services in Putnam County, such as the proposed stabilization center, in addition to our existing mobile crisis team, serve to have a positive impact on businesses in the local community. Feedback from community members described local law enforcement and emergency services having to intervene on individuals, causing a disruption to local businesses. The stabilization center would be a resource for these individuals, giving them a place to go where they will receive the care they need.
So I just want to ask you on that one.
Sure.
I'm a little confused. So are you saying that people who disrupt the community would have the ability to, say, walk over and go to your crisis center? Or are you saying your mobile crisis team would go out and intervene?
The mobile crisis team would go out and engage and have a conversation with that individual, and if they got to a level where they felt that the stabilization center is appropriate for them and the person volunteered that they would go to it, then they would take them with them.
Okay.
Do you get dispatched through 911?
Do we get dispatched through the helpline, which is in the 911 facility. So there's been training in Westchester and Dutchess County that we've done where we've trained the warm line or hotline staff with the 911 staff, and they've co-located that so that there is conversation around when they can, reach out to the stabilization center with the appropriate level of care.
So if a business owner in Putnam Plaza felt they needed help, how would they go about getting it?
They can, well, they'd have to call the mobile team.
But they would call 911 probably, right?
I would imagine. Yeah.
So I also oversee the mobile team that we run in Putnam County. So we don't have a direct dispatch. Like dispatch will not make the decision
Right.
to call the mobile team, but if the officers that are on scene make a request for the mobile team to be present, then dispatch can call us. It is up to the officers' discretion that are on scene. We also work very closely with the co-responder team with the sheriff's office, and we're open to any referrals from any source, not exclusively law enforcement. And, we will be working with, very closely with the stabilization center. And we are currently working very closely with the county and the law enforcement partners. So yes, if somebody has an issue, and either whether the police are on scene or whether they want to call the mobile team directly to have somebody come out to talk to a person in crisis, we're absolutely able to do that.
So the police are most likely your phone call, them calling you.
Yeah, I mean, it's some of it is just a knowledge base for the, the businesses in the larger community that they may not know about this resource in general, but law enforcement has definitely had some education on it.
And we do have a marketing plan, once approved, that we can educate the community on the services available.
So it doesn't have to be the police?
No,
Say a local business can call you guys directly?
anybody can call.
Yeah, anybody can make a referral. It can be the participant, the person themselves. It can be a person, you may just be concerned about somebody. And then, the mobile team will be that response in the community. And then we make the determination of, what is the best plan for this person and how safe are they for themselves and somebody else. And it's, again, a licensed clinician that is making that determination on site with this person. So, I don't want to confound too much with the stabilization site, but it is something that we, are able to work closely with the mobile team and the stabilization center.
So you mentioned if somebody calls, whether it's the person or a business owner, if the person doesn't want to go to the stabilization center, what's the next step? So they're in some kind of crisis, and you recognize that because, to your point, the clinicians are there, and they say, no, I don't want to go there. What happens then?
Well, I mean, it depends on what all the precipitating factors are with that person and what they're looking for and what they need. It's not necessarily like a hardline answer of, this person shows up here, they give us these answers, and it's not a formulaic response. So it's really working to move them on to the next best step for them. And that would be, if it's a local business calling, to help move that person on to where they need to be.
I mean, this
But
is
it's
why
always-
you have clinicians doing the job, because they
Right.
can assess these folks, and it's always a case by case. And we have
Right.
mobile teams in Westchester and here, and
Right.
it's always a different situation.
I understand that, but you also said it's voluntary, that they come to you
The center is
The
voluntarily.
center is
Voluntary,
voluntary, yes.
But if they, no, I'm not going, and they, cause some kind of commotion, what happens then? Then police just take over?
If that's the case, I mean, it's really, the whole reason for us to be in the community with the mobile team is to de-escalate and get people to at least accept help. If sometimes you may not be able to, and if that's the case, then it goes to the next level. And if that's police, or if it's a 941 or a mental hygiene law factor or whatever, that gets followed. I mean, that's always been here. There's nothing different with that.
I'm confused about something. You say that the use of your crisis center is entirely voluntary on the part of people. At one of our previous meetings, we received a copy of the explanation of New York's 2023 bail reform amendments. And I'm going to read the point out loud. In turn, the 2020 amendments added mandatory programming. This is a discussion about when judges can lay on conditions beyond bail in terms of somebody's potential release to the public, pending trial. The 2020 amendments added mandatory programming as an available non-monetary condition and defined such programming to include counseling, treatment, and intimate partner violence intervention programs. The 2023 amendments further clarified that treatment includes mental health and chemical dependence treatment, as well as gave judges the option to refer people to crisis stabilization centers. So it seems to me, certainly without being an expert in that area, that there's going to be some number of people who are, as a condition to their being released without bail or on bail, that they have to attend a crisis stabilization
They
center.
can't. Under Part 600, they cannot, by law, be mandated to a crisis stabilization center. They can't.
So you're saying this is wrong?
It's wrong.
I would also note that you're stating that a judge would mandate to a crisis. These are 23-hour, 59-minute.
Oh, you know what? You're talking about a CPEP. That's what they're determining crisis stabilization center. New York State is a comprehensive psychiatric emergency program, which is very different from a stabilization center. They worded it wrong, but that's what they're talking about, are the CPAPs in New York State.
So you are saying that you will never have a client that is required to come to you by virtue of a judge's
Yes,
decision in the context of a
Yes.
criminal proceeding?
absolutely.
Hi, thank you. I'm Tammy Robson. I'm the Assistant Vice President of Crisis Services at People USA, and I've been a part of the Crisis Stabilization Center since January of 2021. So that is correct, that we have never had anyone who has been mandated to our center in the 5 years that I've been there. This is a completely voluntary placement. And if I can just kind of go back to something earlier as far as the danger to self and others, we were focusing on that a lot, and I just want to identify that typically when we're using that terminology, I'm a licensed clinical social worker. That terminology is referring to individuals who are thinking of harming themselves and at risk for suicide. So that is primarily what our assessments are doing. So with that wording in clinical terminology, serious harm to self or others, it is focused on someone who is in an imminent risk of harm to themselves. And there are, as we had said, parameters to get individuals assistance if beyond our crisis center, they need a higher level of care.
But it can include someone who is a risk of harm to others?
Typically, if somebody is in a state of crisis, I think it's important for us to look at the word crisis. We are identifying that these are individuals in our community who are angry, who are upset, who are having behavioral issues. These are individuals just like everyone in this room. These are individuals, these are our family members. So these are not individuals who are violent and aggressive. Do we have individuals who sometimes get upset because their needs aren't being met in the community or they have losses in their life? Absolutely. But we're all there with them and we're helping them through that process. I've never been fearful for my safety in the 5 years I've been there. Thank you.
But yet, we heard there were 52 police calls over the course of 20 months, right? So what were those calls for?
And I would have to look at the specifics of that. In Dutchess County, I can say if we call for an ambulance, say somebody wants to voluntarily go to the hospital, they need inpatient treatment, we typically would try to call the ambulance directly. Oftentimes, the ambulance doesn't have the resources to come directly, so we then have to call 911. It's part of the policy and procedure. When you call 911, ambulance comes, police come.
No, well, actually, what we were told in Poughkeepsie is that when an ambulance is requested, police do not automatically come. So that would have to be a separate request.
If you call the ambulance directly, so forgive me, I don't know the ambulance off the top of my head, but when you call the ambulance directly, they'll say, we don't have the resources, you need to call 911. They'll dispatch the ambulance. So that's often the situation that we run to. And when 911 dispatches the ambulance, police respond.
It's not exactly my understanding, but okay.
Yeah.
Please continue.
Okay, what are the admittance and release protocols? Arrivals, there is no referral necessary to be welcomed into the center. Visits to the center are entirely voluntary. Individuals may be voluntarily referred to the center by schools, other crisis services, law enforcement, social services, mental health, substance use treatment providers, or may be self-referred. The center's policy is a no wrong door approach and will triage, screen, and assess all individuals who arrive voluntarily to the center. The center can connect individuals with community resources and services as appropriate to guests' assessed needs. The center does not offer shelter services and will refer guests to local shelter resources or social services when presenting for shelter. Service transition planning is informed by all interventions, screenings, and assessments. Guest choice is always respected and accommodated, except in cases of imminent safety concerns. Stabilization Center has clear policies and procedures surrounding clinical risk assessment protocols, which include 24/7 access to an administrator on call for consultation and oversight. Guests will be given linkages to community resources with staff's recommendation for the most appropriate level of care. Guests and staff will come to a shared agreement regarding the guest discharge plan. Guests will all be provided transportation back to their residence or warm handoff to the next step in their discharge plan, which could be another provider or service.
Excuse me, question about that. The point about the guest and staff will come to a shared agreement regarding the guest's discharge plan. So let's assume someone has been there for 23 hours and 55 minutes, and they're not agreeing with you as to what the next step should be. Do I assume if they don't come to agreement, they walk out the door at hour 24?
No.
What happens?
They would either be transported back to their residence, or if there was a higher level of need there, then the staff would get the
Person
appropriate-
walked in off the street, whatever the experience is, it didn't work out for them, or they're brought there by a relative or whatever. And what if they don't want the transportation that you're offering? What if they don't want to go? I mean, we're talking about people who could potentially be, you said, your other colleagues said it themselves, they could be angry, they could be distraught, agitated, they just don't agree. They don't want to do what you want them to do. What happens?
Like I said, they would be assessed, and they would either be transported back to wherever they came from.
Person says,
or
I don't want to go
they-
where you're sending me.
He's still answering your question.
What am I doing?
He interrupted you as you were answering the
No.
question.
Yeah. I mean, it's a common sense approach to caring for people. If they come to the center and they're willing to stay and work with us and talk with us, and at the end they say, I don't want that, we'll say, okay, so then we're going to bring you back home.
And if the person says, I don't want to go home?
Yeah, could you just?
So, coming from our clinical process, as somebody enters our door, I think it's really important to know from the moment somebody comes through our door, we're assessing what are your needs, what are you looking for, how do we accomplish that? So we're not waiting till hour 23 to come to some decision. There's consistent engagement. Often most people are at our center less than 6 hours, on majority, or probably between like 3 to 4 hours, and that's enough time for us to engage, make a connection. So I think it's really important to note there is consistent engagement. Somebody isn't sitting in a room alone, and then 23 hours later, we're trying to come up with a plan. That discharge planning and best practice approaches happens from the moment somebody enters our door.
I guess what I'm doing is coming at it from the point of view of, despite your best intentions and all your skills and all your efforts, things don't go as planned. It happens. I think we've heard from the community a lot of concern about people going in and then coming back out into the immediate physical area around you. And are you saying 100% of the time that will never occur?
I'm saying that nobody is leaving our center without a plan. So we have a lot of collaborations, a lot of partnerships. We're making connections. Oftentimes, it may be treatment centers outside of our facility. We're doing warm handoffs. And the one thing that we've never talked about is we don't just engage with that person on that day. We follow up with somebody for 30 days afterwards. So we're having consistent engagement with this individual to make sure if we've made any connections for them, those connections were successful. Their needs were met, that they're not in an ongoing state of crisis. So there's ongoing follow-up that's happening as well.
I understand that that's the goal, but are you standing here and saying that there's never been a case where somebody has walked out of the Duchess facility because they just don't want to cooperate anymore or participate?
Yeah, and that's, they're right, but nobody is walking out of our center that is a danger to themselves or anybody else. So you may come into our center and you may think you want some support, and then you decide you don't. If you're not posing any risk to yourself or somebody else, you have the right to walk out the door. If we've assessed there's a danger and a risk, we're going to be calling the mobile team. We're going to be calling somebody. And that's somebody who may be in need and not ready for help. And that's why the stabilization center is not the appropriate place for them, because it's a place for people who are voluntarily looking for support and help and engagement.
It's important to remember that this is not a standalone service that doesn't exist without a network of teams, supporters, and providers that all work together to get people to the right location.
I just want to say that I was the one that brought stabilization centers to New York State. I researched around the country and different parts of the world because so many people that do look for help go to emergency rooms. They get marginalized, they get treated poorly, and they come out without a plan, without a follow-up, without anything. Those are the folks that leave agitated and go out and do something that could be dangerous to themselves or others. Imagine a place that you go to where people will smile at you and welcome you regardless of your addiction or your mental health issue and say, we're here to help, we're glad you're here. Hospitals don't say, we're glad you're here. I designed this because I wanted this to be an experience for people that want help to get help. I wanted families to understand that they're not alone when they bring their child to a crisis facility, because we'll work with the families as well to educate them on how to work with their children. This was created, we have a lot of what-if questions that can, and when I first designed it, I got every what-if question that I'm being asked here today. And the thing I said was, what if people come and they heal? What if people come and get better service? What if people come and get to a better quality of life because they didn't go through the trauma of our traditional system, which exists right here in Putnam County? Our hospital is not the best hospital for people to go to or to people to walk out of. This was created as a step for voluntary service to help people and truly help them and follow them, because hospitals don't follow you either after you leave. We do. I felt that was so important to call someone after they come to the center to say, hey, you came in yesterday, how are you doing today? What can we do for you today? There's so many positive aspects of this service that we want to bring to this community. And it's difficult for me to have done all this great work in our country and in our state and have such a difficult time trying to explain you're getting a service that is gold standard. This is what this is going to be for this community. And I just wish you can keep that in mind as I answer these questions.
Yeah, I don't think there's a whole lot of pushback on what it does and how good it could be, has been, will be, whatever. I think it's the location. That's really what people are concerned about.
Please, no more side conversations. Very disrespectful to the people, plus we just can't hear. I'm sorry, Vicki.
I think
Vicki
also-
brings up a very valid point.
That's the issue, honestly. I think if you ask anybody, although we're not asking people because it's not a public hearing, I think nobody would say, oh, no, it's not a good idea. It's where it's going to be is the bad idea.
I can say
But
that
the-
we're not the only stabilization center trying to get into a location. Just about everyone is getting a pushback because people don't understand it. If
Understood.
people understood it, it would be a totally different story here.
But we already have the methadone clinic not far away, and that's caused some issues. We've had
That's
other
the
things.
methadone clinic, though. I mean,
I understand
you
that,
know.
but it's also people who are not stable or, have been drug users or whatever, and just to have something else, not so similar, but not so different, I think that's what's caused the issue. It's not what you do and how well it gets done and the results, it's where it's gonna be, where it's proposed to be.
Thank you.
Okay.
Please continue. Are you done?
Yeah, I did the staffing already. So the question was, how will the facility be funded? And do funding levels vary? If funding is reduced, in the future, how would that impact the operation of the facility?
Can we go back? I'm not sure if this is what you're referring to as staffing, but
Yeah.
the cap on the maximum number of patients, I'd like to ask a couple questions about that.
Oh, I'm sorry, yeah. Will this facility have a cap on the maximum number of patients? An average of 8 identified guests can be served at one time at the stabilization center. In the unlikely event that there are more than 8 waiting for services at once, staff can utilize other People USA services, such as our mobile team and our crisis respite house.
So let's, again, assuming a worst-case scenario.
Worst case.
It's, 11 o'clock at night, midnight, something's in the air that night, all of a sudden 12 people show up. You're now over 8. Can you explain the specific process and timing of how those extra 4 people get parceled out elsewhere?
That's so unlikely, but if it did happen, the respite house would be contacted and people would be able to utilize that, and then the mobile team would be assisting with the
But
transportation.
what does that mean? You say respite house will be contacted.
We
Where is-
operate.
Where is it?
Yeah, it's in Garrison.
And how long would it take for somebody to be moved from your facility over to Garrison?
Well, I mean, it would be a phone call to the mobile team, which they dispatch within minutes and get them to the center and move people if needed.
So the mobile team is on tap 24 hours to service an event like that?
Yeah.
Where is the mobile team stationed? In other words, when they're not activated, where are they?
They're at our Rose House in Garrison. Yep. Yeah, they will be based at the center eventually, but they're at the Putnam, or the Garrison House. Okay.
I think you were on the next page because you went through.
Yeah, I went through the staffing, so. How will it be funded? So we're receiving startup funds from Putnam County. Once licensed and in operation, it'll be self-sustaining by using insurance reimbursement.
Whose insurance is that?
It's Medicaid, and actually, we just made our first contract with private insurance as well, so that'll be the goal, is to continue to expand the insurance possibilities.
So, forgive me if I don't have my facts entirely right, but when I think Medicaid, I think somebody who qualifies for Medicaid, meaning they're not otherwise insured. And if somebody is insured, let's assume, you know, they have a person who has a job, who has insurance through his employer, your services will be covered by definition by any New York State approved insurance company?
Well, we're working out those negotiations now. We finally got our first contract, and now we're moving on to other.
So you have to go
providers.
insurance company by insurance company?
Yeah.
So what happens if your guests fall between the cracks of what you don't have?
There's no charge.
No charge.
Yeah. All right. Will the facility pay taxes? We're renting the space, so it would be up to the landlord to pay the taxes on the space.
I just have to note a legal objection on the record to that question being asked, just for purposes of our record.
Which
But we
question?
have answered it.
Which question?
About the taxes, because that's, in my opinion, not a lawful reason to make a land use decision about a use. So I just note it for the record.
There is an overabundance of mental health and substance use facilities in the area. How does the town of Carmel compare to other towns in Putnam County in regards to the number of such facilities? We respectfully disagree that there is an overabundance of services in Carmel. Carmel was identified as an area of need in our conversations with the county. The stabilization center is a crisis facility, and there are no other crisis facilities in Carmel or Putnam County other than the hospital. The stabilization center is also not a residential treatment center. What additional burden will be placed on emergency service providers? People USA and Putnam County have discussed and addressed any questions regarding emergency services use and concerns with the Carmel Police and Putnam County Sheriff's Office. People USA's program director will be available to the Carmel Police and Sheriff's Office to discuss ongoing collaboration with emergency services. And that's all the questions.
Any other, I know we had a dialogue along the way. Any other questions from the board?
I did have one more question. You talk about the payments and insurance and whether or not Medicare, Medicaid will pick it up. Is there any possibility of any of this ever coming back to the taxpayers of Putnam County to fund this facility?
Not that I believe would be.
Has it happened in Dutchess or anywhere else that you're aware of?
No, in fact, we've reduced the county was paying for the center 100%. This year, they're paying half, and next year it'll go down more because the insurance is creating sustainability.
Okay, thank you.
Sure.
Any questions from the consultants? Any questions from the board members?
Where in Westchester are the facilities you're proposing or existing?
Right now, we're looking at Katona, so we're negotiating with the landlord there.
Will this be that one in Westchester or? the
We
others?
will operate that one. There's two others that are going to operate
From
as
other
well.
providers.
Do you
Yeah,
know where they
other-
are in Westchester?
Bronx, I think, is one, or not Bronx, what am I saying? Mount Vernon, and, God, where was the, yeah, I wasn't talking about Bronx. But anyway, there's one other, I don't know where exactly.
So you just mentioned about Dutchess with the funding. So you mentioned earlier, and it was somewhere, that the county has allocated a certain amount of money from, I think, the COVID relief to start your business. To
Right.
get you guys started. Is there
Correct.
any discussions about year two of possibly the county
We
funding?
have a 3-year budget plan that we've created that shows the sustainability of the project.
No, my question is, has the county committed to funding you in year two and year three?
Yeah, the funding would go into year 2. Year 3, we would be on our own.
Okay.
Is that 100% funded from the county for the first 3 years?
No, because we'll get our license immediately and start billing as well, so the supplemental funds will start
Thank you.
right away.
So look, there was a good dialogue tonight. My recommendation tonight is that give the board some time to think about all the dialogue. There's a lot to think about. And Pat, can I ask you to prepare a positive and a negative resolution for the next meeting? And the next meeting will be a voting meeting.
So, Mr. Chairman, Ms. Valk has given an extension with respect to a decision by the board to February 19th. So as long as we hold a meeting prior to that date, no further extensions are necessary.
As far as I know, the next meeting will be the 4th Wednesday in January.
January 28th is my understanding from your
Yep.
website.
There you go.
So we're good.
Yep. Thanks, Joe. Good point. Okay, thank you
All
for
right.
your time and patience tonight.
Thank you.
I appreciate it.
Thank you.
There's no questions from the board tonight. Can you give us something? Yeah.
The answer is no. The public hearing has been closed. She can submit anything that she
You can
wants to
submit it to
the
Rose.
secretary.
A lot of people during the week send notes and emails to Rose. You can send it to Rose. I'm not going to look at it tonight anyway. Give it to Rose. Thank you.
Did you not tell us last time that we could give you a signed petition of names that are being on
The public hearing, we were very generous. We were, you can send anything you want, you can send anything you want to Rose, the secretary of the planning board. We were very, very generous with the public hearings, as you know.
Just so the record is clear, the public hearing, we've had 2 hearings. They've been closed. The public comment, written comment period is likewise closed. The only thing that remains for the board to do with respect to this application is to vote it.
There you go. Thank you, everybody. We're going on to the next topic tonight. I couldn't understand it. We've discussed that 100 times. No one flew out. We've discussed that 100 times. Thank you. Next on the agenda,
Yeah, I know, it's hard.
we're not allowed to. The meeting's cool. You've had plenty of time to speak. We've had two public hearings, and we've had written comments for 10 days.
Send things to Rose.
Thank you.
We feel bad that you didn't get to speak, but
You're welcome.
We've had, next on the agenda, Greenpoint Tree Service, 61 and 65 Old Route 6. Hello, Paul.
good evening. Tough show to follow.
Greenpoint Tree Service, 61 and 65 Old Route 6. Mike, I believe you had some comments?
Yeah, the necessary variances were granted by the Zoning Board of Appeals on December 4th, and they are noted on the plat.
Thank you. Rich?
So I've met with Paul just recently about a water and water shutdown plan, so he's developing that right now. He's provided water and wastewater, he's provided a notation of the referrals and comment and permits needed. It's just a matter of really getting that the water shutdown plan going so that we know that we're able to isolate the area and he's able to tap into the system.
And Pat?
And no issues, Mr. Chairman. As you know, you've selected the alternative you preferred. Paul has now engineered that alternative. They have their variances, so you can move forward with this application.
Have we seen a rendering on this building?
Yes, we've given you a couple of different varieties.
It's been a while, right?
Yeah. I didn't bring one tonight but I'll bring one next time.
And one of
we
the
come.
issues, Mr. Chairman, was asking them to enhance the landscaping, which they've done to the extent they can. So there's little planters between each of those parking spaces and
I
so forth.
remember talking about that,
There's not a
yes.
lot of room to do it, and the stormwater basins in the front of the property, so there's not a large area to plant in.
Yep.
So
Yeah,
there's limited.
I was just going to say, actually, the stormwater planters in front of the buildings are actually about 200 square feet. So they are fairly large, so they break up each individual unit. And they will be planted with wetland plants and shrubbery and that sort of
Yeah,
stuff.
we did have the discussion, because I remember we were saying that it is a commercial area, but we still want it, an industrial area, actually, but we still want it to look nice. Any comments from the board here? Otherwise, I believe we need to schedule a public hearing. Do we have a motion?
I make a motion to schedule a public hearing.
Second.
All in favor?
Aye.
Just bring renderings for that public hearing.
Yes,
Yeah,
I'll bring the
that's a good
renderings
idea,
back
'cause
for
that
that.
might come up from the.
Yes.
Good point, Mike. Thank you. Next on the agenda is Liberty Bell Trucking, 39 and 47 Old Route 6, right down the street. Mike?
Yeah, there are 3 variances needed from the Zoning Board of Appeals. Provide an easement for the access across Lot 1, their driveway cuts across the adjacent lot to get in, and provide floor plans and elevations so that the board can see what these buildings are going to look like. There's 2 buildings going up there, 5,900 and 5,000 square foot buildings.
Actually, Mike, I think you probably didn't get the submittal then, because I did drop those off, so it must not have made its way to you.
What didn't I get?
The building elevations.
Oh, okay.
Yeah, so they were submitted, so they do exist.
Good.
And Rich?
So they've submitted a water and wastewater report for review. Referrals are needed for the DEC, ECB, Putnam County Department of Planning, Department of Highway, Carmel Fire Department. Regulatory permits would be for state for stormwater and wetlands, DEP possibly for stormwater, ECB, water connection, sewer connection permits in Town of Carmel Highway. The project does disturb over an acre, requires coverage under the permit with a SWIP. So they may be required to supply a stormwater maintenance agreement or public improvements with performance bond and engineering fees. There are other detailed comments, so when I met with Paul the other day, he knows that he has to develop a water connection permit and system work plan, so similar, it's right up the block from, or actually adjacent to Greenpoint, so he's gonna be looking at that also. There are easements on this property. These should be provided and reviewed by Planning Council. All the plantings should be verified by the Carmel Wetlands Inspector. Notes should be added to the drawing. Traffic vehicle moving, all that kind of turning radii should be provided on the drawing. Sidewalks and manholes, roadway specifications, all the detailed items could be provided to Paul via the memo. But it's fairly standard stuff when it comes to water connections and then everything else that we have to do.
Thank you, Rich. And Pat?
And we're basically okay with this. We're ready to go to the zoning board basically with it. The elevations are pretty basic. Paul, if you could punch those up a little bit.
That we can do. So it was a starting point.
Yeah,
So we can work on that during the course of the process.
that would be very
Yes.
helpful.
Any comments from the board?
Not yet.
So Paul, we're happy to do things in parallel, send to the zoning board, but I'm looking at 2 typewritten pages of comments. So you need to work on those, otherwise when it comes back, we won't go any further.
The nuts and bolts aspect of it, a lot of it has already been done for Greenpoint. So a lot of it is just taking that information and putting it over on this property. So
And
it's, but yeah,
that's one of the reasons why we're willing to send it over to the zoning board, but let's get
We'll
these-
do that.
Let's get these comments down to satisfy Mike, Rich, and Pat there a little bit.
okay.
All right, do we have a motion to send to the zoning board?
I'll make a motion to deny to the zoning board.
I second.
All in favor?
Aye.
Thank you. Next on the agenda is Bunye subdivision, 105 Pitchett Road, for a sketch site plan review, 2 lots. This has been around for a while also. Mike?
Yeah, the necessary variances were granted on December 4th, and they are noted on the plat.
Rich?
Applicant has noted the necessary referrals. Applicant has noted the need for a stormwater pollution prevention plan. If there's any public improvements, they will need to provide a performance bond engineering fee. Stormwater bond and maintenance may be required. And they will need to, for preliminary plat approval, they need to just go through our, the next step and put all that information that we need together to get there, so.
And Pat?
And there really are no planning issues. You could see from the plat 2 rectangularly shaped lots. They're orderly, they're regularly shaped. It was about the variances. The variances have been granted. This is a minor subdivision, so this can go directly to final approval if you choose to make that leap. And in this case, there's no reason why you couldn't do that.
Correct. Correct.
But we have not had a public hearing on this yet.
Right.
Yes.
So what you would do is, the next step would be to schedule a public hearing and direct Paul to prepare the final plat, not a preliminary plat.
So we need a motion to approve the grant, the sketch first.
Yeah, we normally
And
don't
then-
grant sketch plan
Correct.
approval, we advance
Yeah.
it to the next stage. So you can advance it all the way to final approval.
I'm okay with that, as long as we don't bypass the public hearing.
Yeah. Because there's so much
If
fun.
you need to speak, you can come up and state your name. I'm sorry, Pat? I missed that.
I was being snarky about the enjoyment of public hearings.
Actually, no one came to the ZBA meeting. So we had no public show up for that hearing.
I just want to.
It just, yeah, we don't expect anything.
Mark Bunye. I thought the letters were sent out to the neighbors, that this was going to be the public hearing tonight.
No.
Zoning board.
No, that was last month where we had the ZBA meeting.
Oh, letters were sent for the ZBA meeting
Yes.
as well, okay.
Yes.
I'm sorry.
So motion to grant sketch plan approval?
I'll make a motion to grant sketch plan approval.
Second.
All in favor?
Aye.
Aye.
And do we have a motion to schedule a public hearing?
Mr. Chairman, I'll make a motion to schedule a public hearing for Piggott.
I second.
All in favor?
Aye.
Thank you.
Thank you.
And you're allowing him to go right to final?
Yes, yeah. It's like Pat says, pretty clean. Another one that's been around for a while is Cass subdivision, 90 Mexico Lane, for an extension of final subdivision.
We're on for our second extension.
How come?
The plat has been sitting in the Putnam County Health Department for about 2 months, and it has not been reviewed. And if I can't get a review and whatever minor revisions I gotta make to it, I can't bring it to you for signature.
Mike, I don't believe you had any comments, did you?
I do not, I was just gonna say why, but you.
And Rich?
Yeah.
Nope, no objection to granting the extension.
And Pat?
Yeah, it's not Paul's fault, it's the health
So this would
department.
be 180 days to 6 months, right? So stay on it the best you
Yeah,
can.
I'm actually heading over tomorrow
Great.
to sit down with them, because actually I have 3 projects that are sitting there. They're just treading water.
Any comments from the board?
Good luck.
Well, this is one of the reasons why with like Gilmore, it's another 2-lot subdivision, which we're ready for resolution, and I held off on that, is because I know there's just this time lag to get things through the regulatory process. So I am through the health department with Gilmore, so that will be coming back for the final resolution, so that can get done within that, the 6-month time clock. But I
And just
think that's a
to that
tactic that
point, it's extension expired, reapproval, significant fee on the part of an applicant, all because the health department didn't get around to something. So the system isn't quite working. It's not our fault. It's somebody else's system, but it lays into our system, and potentially it's a burden to applicants.
Is that prevalent in the county and the state?
So health departments are never prompt. I think that's a fair comment to say, but.
Ours is great.
Ours is actually good. Westchester's is awful right now. But it's a long time period.
All right,
I can't control that.
let's move ahead.
But
Do we have a
thank you.
motion to grant 180-day extension?
I will make a motion to grant 180-day extension.
Second.
All in favor?
Aye.
Thank you very much.
You're welcome. And then, is anyone from Viola here?
No show for them at the moment.
Well, then we're gonna hold them over. I know Rich the bond return, but I don't wanna move forward without them here. Rich, we're gonna hold them over, they're not here.
That's fine, okay.
Make a-
Good night.
Good night.
Good night, Paul. Rose distributed the meetings of, the minutes of December 11th, 2025. Has anyone had an opportunity to review those?
Mr. Chairman, I read them, reviewed them, and made some minor comments. I make a motion to approve the minutes, subject to those comments.
I will make a motion.
All in
to
favor?
Accept that.
Aye.
Aye.
Sorry.
And do we have a motion to adjourn? Nick, you want to make a motion to adjourn?
Mr. Chairman, I'll make a motion to adjourn the meeting of January 8th, 2026.
Second.
All in favor?
Aye.
Good night, everybody.